As you know, the United States of America, our very great country, is the only nation in the entire industrialized world that does not guarantee health care to all people as a right. Second of all, we end up spending almost twice as much per capita on health care as do the people of any other nation. Thirdly, our health care outcomes and our life expectancy falls behind many other countries who spend a lot less. So my own view is that we should learn from the rest of the industrialized world, say that every man, woman, and child is guaranteed health care, expand Medicare to all people.
So,
that's my view.
Well, let me ask you this, because you're in Vermont, you're right on the edge of Canada.
Yes.
Canada is obviously a model. Two pieces of data. One, the Canadian system is going up at about 8% a year in cost right now. And two, 43,000 Canadians last year came to the United States for various things they couldn't get in Canada. Now, my question for you would be, if we went to national health care, where would the Americans go who needed to get things they couldn't? I mean, the Canadians right now can come here because this is still a relatively open system.
Let me respond in this way. I was the first, actually, when you were Speaker, I was in the House. You know what I did? I took Vermonters over the Canadian border. Do you know why? Because women who were dealing with breast cancer were paying 10 times more for breast cancer drugs in the United States than they were in Canada. Second of all, some of those trips from Canada into the United States are paid for by their government. Third point that I would make is that certainly the Canadian system is not perfect. There is no healthcare system in the world that's perfect. But they have had, as you well know, a very conservative prime minister in Canada, right, for many, many years. Now, if you had a conservative prime minister who thought their system was so terrible, I would have imagined he would have repealed it years ago. But he understands it would be political suicide because the Canadian healthcare system is popular in Canada.
But what they are doing is starting to allow private clinics. There are now 600 private clinics in Quebec, and the system in that sense is beginning to devolve back to much of what we have, which is a two-tiered system.
Well, I would not say their system is anywhere close to where, you know, they will deal with their problems as they see fit. They do have their problems. But I would tell you that the Canadian healthcare system is a lot more popular in Canada than our non-system is in the United States.
Well, let's talk about our system here.
Right.
You cherry-picked some things that you liked about the bill, and I like those things as well. But one of the things I think a lot of people are concerned about, you talk about these jobs numbers, and people are doing all this sort of fear-mongering saying that the job numbers are bad. When you look at the actual numbers, job growth is continuing. 91% of all the jobs that are being created are full-time jobs. I don't understand. Now, if you're concerned about jobs, in your own state, the Hospital Association got together and they said in a report that if you fully implemented Obamacare in your home state, you get 44,000 jobs. Why don't you want those 44,000 jobs? You're a champion for jobs. You fought for 2,000 jobs for Boeing. Why are you flushing 44,000 jobs down the toilet in South Carolina?
I never thought I'd live to hear myself say this. Listen to the unions.
That's it.
All I can tell you is that this thing is stinking up the place in terms of what people thought they were getting. At the end of the day, Medicare and Medicaid by 2042, these two government programs that we're talking about, are going to take more money to run than we collect in taxes today.
Are you satisfied with the system that we have right now?
No, I'm not.
Right now we have big private
I'm going to
insurance
challenge
companies.
Bernie to see if we can agree on something.
Okay.
If you make over $250,000 a year in retirement and you're on Medicare, you get $108 a month subsidy from the federal government. I'm willing to tell people that make $250,000 a year, you shouldn't get a penny from the federal government.
Well, I'm willing to look at that, but the issue is...
It's called means testing.
Yeah, but the issue to me is once you start coming up with a number, Lindsay, and you may start at 250, some of your colleagues will bring it down to 100 the next year. Next year it's 50, and then it's welfare. So I worry about that. I am more in favor of a universal system which says if you are very, very wealthy, guess what? You're going to be paying more in taxes, and you will be part of a universal healthcare system.
Bernie is a man of his convictions. When you look at the world, most people are coming our way. We're not going there. Most people with socialized medicine are trying to find ways to lessen the cost because it's taking their whole economy down. Competition is a good thing. It's a good thing.
Let me just respond to Lindsay, because that's not quite accurate. Lindsay, we are spending approximately, somebody correct me if I'm wrong here, but I think about 17% of our GDP on healthcare. You have countries in Scandinavia, in Denmark, where everybody has health care. They're spending 8-9% of their GDP. So we're not, you know, what they are spending significantly less per capita and a smaller percentage of their GDP than we are.
But let me ask you this
And they
question.
have 2 tanks and 1 airplane.
Yeah, but let me just ask this question about this. In the 2 largest provinces in Canada, Quebec and Ontario, they now spend 50% of their government funding on health care. For half of it on health care. I mean, the problem is, and I think this is a universal problem across the planet, nobody has figured out a model which drives down cost. And the result is, if you assume everybody gets everything they want, you end up in a system which ultimately is going to bankrupt the country.
Well, I don't think that's a fair statement. I think there are many countries around the world that are providing universal health care that is cost effective. But you're right in raising this question. Philosophically, say in countries like Denmark and Sweden, people have decided that they think it is in their best interest to have, quote unquote, free college education, free health care, free child care, excellent educational systems. Do they pay more taxes? The answer is they do. In this country, we don't do that. So it costs $50,000 for your kids to go to college. Your taxes may be low. Those countries have added it all up together, and they think they get a better deal in terms of universal health care without out-of-pocket expenses.
The European model is not going to go well here when it comes to tax structure, education, health care. We're not Europe. And the more you try to make us like Europe, the more rebellion you're going to get. We're not a perfect party, but one thing I think Republicans deserve is a vote. I don't like the idea of defunding the government because we can't get a defund Obamacare. I think if the government shuts down next Monday, it will blow back on us, and that's not a smart tactic. But why can't we have a vote on suspending the 1-year the individual mandate for a year? We haven't had any really opportunity to vote on repealing the medical device tax.
Well, here's what I would say.
Let us vote.
Well, I have no problem with that. We didn't talk about Quebec. You have, in this country, you got 10 Republican governors that are actually opposite of you in your own party who are actually involved in expanding Medicaid. We got a lot more to talk about when we get back. But let me, before we...
But none of us are going to run in Quebec.
I'm not talking about Quebec. I'm talking about Michigan. I'm talking about Ohio, where Republican governors are actually doing right by their citizens and getting more people in the system. You're trying to keep them out.
America, where this bill is stinking up the place.
Well, thinking of somebody who's thinking up the place, I want to show you a picture that I'm happy to show. You may or may not like this guy.
I don't know that there
but
was
right now, you've got Senator Ted Cruz, who's about to start the 5th hour of his talkathon against Obamacare. I don't agree with his position, but I think he's tapping into something really important, and that's next.